So this video is false lash application, and I'm going to go through some of the processes that we would do before our client arrives. Before I even set up, I'm going to wash my hands. That's the number one thing I'm going to do. And you go through the hand washing procedure. So we wet our hands with water, we get our liquid hand soap, we wash the hands, the palms down to the wrist, the back of the hands down to the wrist. We wash our fingers, we wash the back of our fingers, we wash between our fingers, we wash between the fingers and the thumbs, we wash, I already said back of fingers, fingertips and nails, thumbs, wrists, and we do all of that like interlocking and interlacing for 20 to 30 seconds. And then we do a thorough rinse. We grab a paper towel that's disposable. We turn off the water. We thoroughly dry our hands off. And then we find our hand sanitizer and we go through all of that again. And this is before we even prepare the room, which is what we're going to do and talk about before we greet the client. So in order to be ready for this service, you have to prepare your room that you're going to work on your client. So what you need to do is set up your, let's clean first and then we'll set up our equipment. So we're going to disinfect our workstation, bed and equipment using a disinfectant wipe. We're going to follow the manufacturer's directions on that. We're going to dispense products needed for the service, which we've done and set up over here on our tray. So what we have here, on our tray is we have disposable gloves, we have lashes and lash glue, we have small scissors, tweezers, we have rounds with our makeup remover, and we have, of course, antiseptic lotion if we need it, our disposable mascara wands, and then a single-use, obviously disposable applicators to put the glue on the lashes. We've got some disposable paper towels as well. So our station is set up, and we have to drape the bed before the client gets here as well. But let's talk about what we do when our client arrives. So of course, you know your hands are clean. You're going to greet the client and you're going to escort the client to the work area because you're going to talk first to determine if everything's okay. You're going to assess the client's current style and determine the client's preferences. You'll assess the client's needs. You will assess the client's skin by performing a visual skin analysis to ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area to be worked on, or an open wound or sore in the area to be worked on, infection or infestation, i.e. lice, to prevent from safely performing the service. You'll assess the client's consultation form for any medications and products used within the last 72 hours, and you'll consult on any known allergies. You're going to consult with the client on any facial surgeries within the last 3 months, and if the client is under a physician's care, you'll assess if the client is prone to cold sores or fever blisters. You'll assess if the client has used exfoliating or lightening agents within the last 72 hours, like alpha hydroxy acids, beta hydroxy acids, hydroquinone, etc. You'll assess facial injections within the last 3 weeks, like Botox or hyaluronic fillers. If the client is free from all of the above, we can move forward with the procedure. So let's get our client ready before you wash your hands before you get started. So what we want to do here is have the client disrobe for this. They don't need that. You're going to place a headband or drape, which we've done, on her head. You're going to place a cover over her clothing, which we have done. You can place a rolled towel under the neck if you need support. This one's going to be fine. I've got my towel right here. And now you will wash your hands. So you're going to go to the sink and you're going to turn that water on again. You're going to wet both hands, and then you're going to find your liquid hand soap, coin size, washing your hands together like we said before. So we're going to do our palms. We're going to do the back of the palms, down all this down to the wrist, fingers, between the fingers and between the thumbs and the fingers. You're going to do the back of the fingers, nails and fingertips, thumbs, and wrist. And you remember 20 to 30 second minimum of the wash. You rinse underneath the water. thoroughly. And when it's properly done, you're gonna grab a disposable paper towel, turn the water off with that hand, with the paper towel or a clean towel. And then you're gonna find that hand sanitizer, you're gonna apply it into the hands. Now this service is done with gloves on, so after your hands are thoroughly dry here, I am going to apply my disposable gloves. And once you have your gloves on, you can come over and do your first steps. So the first thing we want to do is, sorry for the glare, remove her makeup, if she has the makeup. So we're going to take some makeup remover and a cotton round and brace. So we're working on that eye area. Dispose of it. And because it's damp, I'm gonna dry it. I feel like it's glaring. There you go. If you need to repeat, if there's makeup, you can't. Now we're going to grab our disposable mascara wand and we're going to comb through the lashes. And we're going to discard that single-use mascara wand. Now what we need to do is measure the length of our lashes. So we're going to come over here and we're going to take one of our lashes off. And with lashes, the shortest part of the lash goes into the nose. So there actually are two, there's a right side and a left side. So what I'm going to do is I'm going to come over here to her eye and I'm going to line it up and measure with the length of her eye. And it's actually a really good match lengthwise, but I'm gonna pretend like we need to do a little trimming. So see how I'm just measuring? I'm gonna hold that measure with my finger. And then I've got my little scissors here, and I would come in and just snip that extra off if I needed to, but the length is really good. So that's important that you take the time to measure. And I feel good about it. So then I'm going to go over here. I'm holding on to my lash and I'm going to apply the glue. So I'm going to get a disposable wand to apply that lash glue to the root of the artificial lash strip here. And I'm going to toss it. And I'm going to grab my tweezers to apply the lashes to my client. Once again, I feel like there's a glare. There you go. So that side looks great. So I'm going to do her other side. Same thing, I need to measure. So I'm taking, of course, the short end is into the nose. And I'm going to measure which This is a really good measure, but remember, if you needed to, you would hold the end with your fingers so you know where to come in with your scissors for the snip. But this is a really good fit. So I'm gonna come over here to my tray and I'm gonna get my disposable applicator, my glue, holding my strip lash, and I'm gonna apply the glue to that root of the lash. And I don't want my glue to be non-existent, but I also don't want it to be clumpy or too thick. So I'm just gonna take my time, and if I need to remove any before I try to apply it to the client's lash line, I will. Looks good. Throwing it away, and then getting my tweezers so that I can then come in and lay that strip of lash down. So I'm going to try to get it not right on top of the lashes, but pretty close. Short side in, of course. I'm just lightly pressing, because you're going to wait about 4 minutes before you go to the other eye. Just giving it a minute there to dry. And once again, it looks amazing. And sorry, not 4 to 5 minutes, 4 to 5 seconds. I knew that. And then once she's done, we are going to talk about her client follow-up. So her lashes are on, and as you can see, they look just spectacular.